Hello, everyone. Happy Wednesday. We're getting close to the end of the week here and close to the end of the sequence for sequence 4. So as I get more information on what's going to be happening with final exams and things like that, I will be sure to let you know that. So I wanted to go in and go ahead and start the review of Chapter 15. So I'm probably going to do this in 2 parts for Chapter 15. And the reason for that is I have also included a video, documentary video on AIDS and HIV. It's called The Age of AIDS. It's really long. So part of today's assignment is that you are going to watch the first half of that. It's about an hour and 54 minutes for the first half. And then on Thursday, you will do the second half of the Chapter 15 lecture, and then you will watch the second half of the Age of AIDS video. So today your assignment will be strictly on Chapter 15, even though you're still watching the AIDS of AIDS video first half. And then on Thursday, you will finish the second half of the Age of AIDS, and you will have an assignment associated specifically with that video. If you have any questions, be sure to email me. So Chapter 15 goes over our topics, ophthalmics and otic medications. Again, it's not going to be a very long video lecture, just so you have time to watch that video. So your chapter starts out and focusing on the integumentary system, or the skin system. So it's the tissue that covers the body, which not only includes skin but also nails and hair. So the reason why we have this system is to protect our body from exposure to harmful pathogens and harsh substances. So not only are these things here to help our bodies protect against these pathogens and substances or harmful substances, but it is also set to help regulate our body temperature. So skin is actually our body's largest organ, and there's 3 separate layers of the skin. You have the epidermis, the dermis, and the subcutaneous tissue. When you get in and start looking at this PowerPoint again, you'll see the picture of that, and it shows you where those levels are on slide 6. So your epidermis is your top layer of the skin. This one forms new cells. It sheds old dead cells. So the top of our skin is constantly shedding. So that's one of the other reasons why it's important for us to practice good hand hygiene, but also when we're going in and doing sterile products preparation, and when we did our hand washing, we washed from elbow down to our fingertips, and that's because most of this piece is going to be exposed in some aspect of sterile processing. So we want to make sure we kind of eliminate those old dead skin cells and get them off. The epidermis also produces the hair, nails, and your glands, and it's interspersed with melanocytes. Dermis is located below the epidermis. It's composed of the connective tissue, the capillaries, and the nerves, and it's also the location of the sebaceous glands and your sweat glands. So we know we sweat, especially here in southern Arizona. And if you ever wondered where those glands are located, they're actually located in the dermis. The subcutaneous tissue is the innermost layer, and it is there to connect the dermis to the underlying organs and tissues. So sun exposure and risk of skin cancer. So living in sunny southern Arizona, we have sun most days out of the year, heat a good majority of the time out of the year, but it's important for us to protect our skin from these ultraviolet radiation lights. So they are damaging to the skin. Ultraviolet A, or UVA, is UVA 1 and 2. That's typically kind of the suntan region. Ultraviolet B is where we get the sunburn region. Characteristics of effective sunscreen. So you want to have an SPF, or a sun protection factor, of at least 30. Once you start hitting up in those higher ranges, 30, 35, 40, 45, they're pretty much giving you the same protection. I wouldn't really suggest, splurging on the 75 SPF, because it's really not much more than what you're getting in the 30, 35, 40 range. But you want to be sure that your sunscreen lets you know that it is protecting you against both UVA and UVB rays. So types of skin cancer, actinic keratosis, basal cell carcinoma, melanoma, which is actually the most dangerous form of skin cancer, and then squamous cell carcinoma. There are therapies for sun exposure. So we have sulfasulfadiazine or Solvadine SSD. We use that not only for sunburns, but also actual burns. So if someone was to burn themselves during cooking or riding a motorcycle and touched the muffler or was involved in some sort of fire, we use the silver sulfadiazine to treat that. And the reason for that is that medication specifically is used to help prevent infections for serious burns. They can use hydrocortisone for burns, and then the most common thing that you're going to see is those aloe blue or green OTC items that you can purchase over the counter. They feel really good if you put them in the refrigerator. It helps soothe a nice warm burning sunburn, and some of these preparations actually also have some sort of numbing agent in it, like lidocaine or benzocaine. Photosensitivity. So this is an increased sensitivity to the eyes and skin, particularly to light. Risk increases with certain drug classes that we used. You've covered some of these questions in previous assignments. You want to make sure that when you're doing the order entry process that you're watching for any computer prompts telling you to put on the auxiliary labels that warn patients about excess sun exposure, and then definitely make sure that these patients are offered some sort of counseling from the pharmacist, especially if it's the first time they're using it, so they can go over that with them as well. Classes that do cause or run the risk of photosensitivity include ACE inhibitors, antibiotics, antidepressants, cardiovascular drugs, some NSAIDs, chemotherapy agents, hypoglycemics, some antipsychotics, and some diuretics. So there's a very wide range of different drug classes that have drugs in it that can cause photosensitivity. Acne. Acne is the overproduction of sebum, which is often caused by hormonal changes. That's why you'll see a lot of times of kids, both male and female, young adults going through the transition into puberty, that they start to get some really bad acne, pregnant women, and then women going through any other hormonal changes, men going through hormonal changes that can also exacerbate the production of acne. So when they say acne, it's encompassing not just pimples, but blackheads, the whiteheads, and even deep cysts that would be in more serious cases. Wrinkles, a fine line or a crease in the skin, promoted by sun exposure, smoking, lighter skin, and then heredity. So as some of us that have grown up in earlier years, we didn't use as much sunscreen, playing sports, swimming, that type of thing. It wasn't as pushed as it is now. And some people are very conscientious or worried about their looks. And so, the wrinkles as they start to develop start to give them a little bit of some concern. So one way to prevent that is making sure that you're putting on some sort of sunscreen protection every time you leave the house, especially if you're going to be out in the sun for any long extended periods of time. Rosacea is a chronic inflammatory disorder seen in adults. This is actually what I have. You can probably see it here a little bit. This is the only area of my body that's affected. A lot of times it'll be the face, but mine's my neck. So a lot of people will say, are you mad? Are you hot? Are you okay? And it's like, yes, I just have rosacea. Mine is triggered by temperature, not so much stress. It can be triggered by stress, but typically mine is triggered from temperature. So in the summertime, I really got a red neck. So Other things that can exacerbate the rosacea: spicy foods, alcohol, hot drinks, exercise, because obviously that's increasing the body's temperature, products which irritate the skin, and then sunlight. Drug choices or drug therapy options for acne, wrinkles, and rosacea. So with acne, they suggest that you're cleansing the areas at least twice a day using over-the-counter products, and then using topical preparation products. And in some cases, they do have oral prescription products. Now, it was very common when I was a teenager, and when children of my age were going through puberty, that pediatricians would prescribe oral antibiotics for acne. But we have now, as a society and a healthcare system, kind of shifted away from that, and that is because of the drug resistance that we're seeing. Wrinkles are treated with retinoids, and rosacea is identifying and avoiding the triggers. And, in my case, I can't. I live in southern Arizona and it's hot. Using topical agents, so a topical cream, and then they do prescribe in some serious cases antibiotics, but again, that's something that we're kind of shifting away from just because of the rise of antibiotic resistance. If you look through, there are different options for topical antibiotics that they can use. So things like the clindamycin or the Cleocin T is probably the most common antibiotic topical you're going to see being used for acne. Dapsone is a newer drug out there. It's pretty expensive for acne as well. The metronidazole oral cream, that doesn't even make sense. Metronidazole topical cream is something that's used specifically for the rosacea, and it works really well. Retinoids. So isotretinoin is something that you've heard a lot about. We know it's a REMS drug, and that it is part of the iPledge program. So again, just a quick recap of that. Some of you missed that question on your quiz. So with the isotretinoin, sorry, email's going off here. With the isotretinoin being part of a REMS program, physicians can still write for the isotretinoin. If it's being written for a male, they don't have to follow these guidelines. But it's being written for a female, the requirement is that both the physician and the pharmacist or pharmacy are registered through the iPledge program. The patient registers, and then the patient has to produce a negative pregnancy test each month before the pharmacy can fill the prescription. And that's because the benefits of the drug are fantastic. It works really, really well, but it is dangerous to a pregnant woman and the baby. Not so much the pregnant woman herself, but it does cause birth defects. Tretinoin, retin A is probably the most common topical you will hear, and that is also used for acne. It can be used for photo or sun damaged skin. And then it's also used in some skin cancers. The interesting thing about the retin A is how the insurance is going to cover that. So if you have a patient who has seen a dermatologist, and let's say this patient is wanting to use the retin A for wrinkles, because it does help eliminate the signs of very fine lines and wrinkles, the insurance company is not going to cover that. They consider that cosmetic. If they write it for a specific disorder such as rosacea or skin cancers or acne, then the insurance will cover it. So your patients have to be very aware, and the physician can't just write for them to use it for acne if they're not having any acne issues. That's against the law. So if they've seen a dermatologist and they want to use the retin A to increase the beauty of their skin and eliminate some of the fine lines and wrinkles, they have to make that's the indication that it's being used for, and the insurance companies are not going to cover it. So you have to prepare your patients for that cost, because retin A is pretty expensive. So dermatitis is pruritic, which means itchy. Inflamed skin that can cause a variety of factors. Symptoms include areas of redness. You can have dry, flaky skin, raised bumps, and then again, it could be itchy. So there's different types of dermatitis. So contact dermatitis happens when you have an exposure to irritants or allergic substances. So you come in contact with something that you're allergic to. So some people can't use certain types of soaps, certain types of laundry detergent. People will get contact dermatitis if they come in contact with poison ivy or poison oak. Again, those two things we don't have to worry about in southern Arizona. Seborrheic dermatitis, or also known as cradle cap, is something that happens typically in infants and newborns, where the scalp will start to turn more a greasy, red, scaly area. It can happen not only on the scalp of the head, it can go to the ears and the upper trunk, even around their eyebrows and around their nose. Diaper rash. Diaper rash is a form of dermatitis, and this is because the skin is in frequent contact with either urine, feces, or both, and so that's why we have a bunch of different diaper rash prevention creams or treatment creams over the counter. I'm trying to think, it's been so long since mine were little, but they have like Boudreaux's butt paste. They have the Desitin. Some people will just use plain white petroleum jelly, and that's because it acts as a barrier on the skin, so when the baby does use the restroom in the diaper, that there's that level of protection on their skin so it's not irritating the skin down there. Atopic dermatitis or eczema is a chronic immunologic condition. It's kind of with eczema is more of like a kind of a autoimmune disease. And these can be exacerbated by stress, exposures to skin irritants, and then food allergies in particular. And there is, if you look into some of the research, there's actually a direct correlation between pediatric patients that have asthma and also have eczema at the same time. Not every patient, but they have a high case of pediatric patients of being diagnosed with both asthma and eczema kind of concurrently. Psoriasis is an immunologic condition as well, or an autoimmune disorder. So it manifests by well-defined plaques that are raised. These can be silvery in color or white and flaky, and also they will itch. They can appear anywhere on the body. They may be very small, or they could be quite large, covering a large area of the body. And these are also exacerbated by stress and other environmental factors. So drug therapies for the four, first with dermatitis and eczema. So we're going to be looking for things like topical corticosteroids. So these are going to help with the itching. These are going to help with the steroid production to stop the topical irritants, and they can also use oral corticosteroids. The seborrheic dermatitis, good hygiene, so kind of bathing the baby or the adults if they have it. Some elderly get it kind of frequently. Using topical antihistamines, using anti-inflammatory agents, and then using a really good moisturizing cream. Eczema, moisturizers will help. Again, topical corticosteroids, and then they will use topical antibiotics for any areas that are infected. So let's say the patient has eczema really bad and they've been itching, and now they've kind of broken open the skin and they get an infection. Psoriasis, they use corticosteroids. They also use immunosuppressant drugs. So again, because this is an autoimmune disorder, our immune system is attacking itself, and in the psoriasis case, on the skin. So we're trying to stop our immune system from doing that, but it puts us at greater risk for other opportunistic infections because we are taking medications to purposely decrease our immune response. That's one of the reasons why our patients that are on immunosuppressant drugs, so transplant patients, cancer patients, anyone on autoimmune disease treatments are very high risk for the corona disease right now because we're weakening their immune system on purpose to treat certain health conditions. Go through the drug therapy there. So dandruff is a malfunction of oil producing glands around the hair follicles on the scalp. So an overproduction of the sebum and the cells will result in layers of the epidermis sticking together, and that's where you get those little flaky spots, okay? And they eventually will flake off. You'll see them if someone's brushing their hair, or you can flake them off with your finger. There are treatments for that. Head and Shoulders is one good over-the-counter shampoo that's used a lot. The main ingredient in Head and Shoulders or Selsun Blue is selenium sulfide. They also have the pyrithinone zinc, which works really well. They do have coal tar, which is another type of shampoo type that they use, and then Nizoral, which will help reduce the itching. So skin infections, impetigo is caused by a bacteria. It is a superficial infection, meaning just directly on the skin. It is highly contagious, so that's why it's common mainly in children in early childhood, because kids are in very close contact with each other. Folliculitis is an inflammation of the hair follicle. Surrounding tissue is not infected. A furnicle, it begins as a sebaceous gland and associated hair follicle, more extensive and deep than folliculitis. So these are infections of, some people get acne type things on their backs or on their arms or on their legs, and a lot of times that has to do with hairs, ingrown hairs, not getting to the surface like they need to. Topical bacterial skin infection treatment. So Neosporin, bacitracin, any of those things, those are available over the counter. You can go purchase those at the store to use topically. They're found in almost every first aid kit available out there. Bactroban is another common one that they use. That is available by a prescription for an ointment. They also have a nasal version of Bactroban, and so this is some pretty interesting information. I learned this when I was working at the hospital in Albuquerque, that patients coming into the hospital, whether they were coming in for routine chemotherapy, or they were coming in because they were very ill, or they're coming in because they're having some sort of surgery and they're going to only stay a couple days, they test everybody for MRSA, and then they actually use the Bactroban. They will put it on a Q-tip, and they will swab the Bactroban into each nostril of every patient in the hospital, because that's actually where the MRSA enters through the body. So because MRSA is so rampant or found in almost every healthcare facility, and we have a hard time eliminating that bacteria from the hospital, we are treating our patients as if they all have the MRSA infection. So they're going to give them that swab of Bactroban in each nostril, so if they come in contact with it somehow, that it won't be able to pass through the nasal passages and infect the patient. Fungal infections, so candidiasis. Candidiasis is basically caused by a particular fungal spore or fungal infection, and these are common infections that happen in the vagina or the mouth. Ringworm is not a parasite. Ringworm is actually a fungus. It's caused by a microscopic fungus, and it can infect either the skin or the nails. You will see it spread outwards as the center heals, leaving a ring on your skin. That's why it's called ringworm, but it is not a worm. Different treatments. We have over-the-counter items for treating fungal infections, so things like athlete's foot, jock itch, those type of things. We have over-the-counter medications to treat those. So viral infections of the skin, so herpes simplex virus. So the herpes simplex virus 1 is associated with cold sores, and herpes simplex 2 is associated with the genital infection. Again, these are, once you have this virus, you have it. So if you were diagnosed with herpes simplex 1 because you get cold sores, you will have that for the rest of your life. It doesn't mean you're going to have a massive cold sore walking around on your lips, 24/7 every day of the year, but it goes dormant. And then things like stress, or if you get sick and have fevers, that's when the cold sores or the virus will re-show itself. And that's when patients start using the topical acyclovir creams or other treatments to treat that. Same thing with the genital herpes. That's why it's important that if you are not in monogamous relationships, and you have multiple sexual partners, that you should still be using condoms even if there's no visible sign of any infection, because it could just be latent. It could just be dormant, which means you're still at risk for exposure. The same thing with warts, genital warts specifically. So warts are an epidermal tumor that is caused by a virus. So warts are caused by viruses. And again, the virus may lay dormant, and it can come back and cause later infection. Abreva is, so we talked about acyclovir topical for cold sores, but Abreva, this acyclovir or the Zovirax is something that you need with a prescription, and the Abreva is something you can purchase over the counter. So external parasites, okay, so head lice. These are wingless parasitic insects that feed on human blood. They are spread by direct contact with an infected person's head, body, or personal items, so hairbrush, hair ties, okay. Symptom of infestation at the beginning and all the way through is itching. Now, unfortunately, we have what we call super lice, and they have been infecting a lot of the schools because these little boogers have been able to become kind of resistant to the shampoos and stuff that we've been using to treat them. So human lice is not just head lice, there is body lice. So you can have body lice that live on clothing and moist areas of the body. We would see this in our homeless populations that were brought in to Palo Verde for any psychiatric treatment. So we would check their bodies, we would check their hair, because not only do we need to treat them, but we also need to not have that spread through the rest of the hospital. And then pubic lice. So there are other terms for this, okay, but we're going to call it pubic lice, which means that this particular lice live in the pubic area. Infestation may resemble dermatitis and be itchy. You can see them, okay, and that's typically transmitted through sexual contact. So, a little fun farm fact here, lice, like other pathogens, can develop resistance to medication. That's what we're seeing. That's why we're calling them super lice. In the past, most lice were susceptible to permethrin or pyrethrin containing products. That's what you see in Nix and the other, I can't think of any of the names off the top of my head, but those treatments that you can find over the counter in Walgreens or any store like that. But now they're developing a resistance to these over-the-counter products, and it's kind of pushing the need for prescription strength items to be dispensed to our patients. There's also a couple clinics that are popping up. There's actually a lice treatment center near TMC that uses a different form of an approach. I'm not sure exactly how they do it, but what I've read is that they do the treatment to dehydrate both the living lice and the eggs, so there's no reinfestation. But part of the problem is that patients have to continue the correct treatment at home. That means stripping all of the bedding, washing everything that they can in high heat, drying it in high heat, vacuuming couches, mattresses, and then bagging up any items like stuffed animals or things that cannot be washed in high heat and dried in high heat, and those need to be bagged up, I think at least for about 30 days is what they said. Drug therapy, there's different medications or different types of things that are used for all three different types of lice. But essentially it's kind of a 7-day treatment, and then you will retreat again just to make sure any that got left behind and rehatched aren't going to be old enough to reproduce, and that eventually will get rid of them. Scabies. Scabies is a form or type of mite. And the female will burrow into the epidermis, secrete substances that disintegrate the skin, and then it feeds on the skin. That's what causes intense itching. The mites typically are more active in the nighttime, so that's when the patient will get a lot of their itching. Lesions are slightly elevated. They tend to be wavy and grayish white burrows, and the lesions are often seen in the webs of the fingers. So I was actually about 7 or 8 years old. I was living in Texas. My dad was in the Air Force, and we were stationed at the Air Force Base in Austin, which is actually no longer there, but it is now the new Austin Bergstrom Airport. So Bergstrom was actually the Air Force Base, and then they closed it and turned it into the airport. So I went to school off base. Our base did not have a elementary school on the base itself, and so all of us military brats were at the same school with also a lot of public children. And I had come home, and over time I remember telling my mom, in my hands were itching really bad, and so she took me to the pediatrician, and the pediatrician's like, oh no, that's just some form of eczema. Well, it continued on. She kept taking me back, and eventually the pediatrician said, well, I'm going to send you to a dermatologist. So she took us to a dermatologist, and lo and behold, I even have a scar here where they did a skin scraping and found that I had scabies. But I was not the only one. My sister obviously had it from being in close contact with me, but almost our entire school children had it. So almost the entire population of the school children had it, and they found the infestation in the sandbox of the playground. So they had to shut that completely down. All of us had to get treated, and it was kind of gross. It's funny to see when you tell people, I've had scabies, and they're like, definitely practicing 6 feet social distancing at that point, but I was a very young child, and I do not have scabies now. And again, it's pretty much the same treatment for scabies, except this is going to be placed or layered on the skin in a cream or an ointment. And I think we're going to go ahead and stop there. That's a pretty good length for the video. We will pick up on slide 46 for your next lecture on Thursday. Again, if you have any questions or concerns, or you need anything, make sure you email me right away. Have a good rest of your day.